Good morning, Barbados. I start this morning by apologizing for the inconvenience that some of you would have suffered when we changed the time of the press conference yesterday twice and then to this morning. But we must take this opportunity to deliver to the country some sobering news. And we thought that we wanted to have all of the numbers and everything in place so that we could speak with you this morning, and that this was the better time. This morning we intend to have a conversation about the progression of the outbreak of COVID-19 in Barbados and indeed the efforts to beat back COVID. Joining me here are Lieutenant Colonel, the Honorable Jeffrey Bostick, Minister of Health and Wellness, Dr. Clyde Cave, Director of Medical Services of the Queen Elizabeth Hospital, and Dr. Anton Bess, Senior Medical Officer of the Ministry of Health and Wellness. I turn the microphones over to the Minister, Minister Bostick.
Thank you, Ambassador Thompson. Good morning. I speak to you today against the backdrop of a few recent tragic and unsettling developments in our ongoing battle to contain, manage, and significantly reduce incidents of COVID-19 infections in our country. First, I would wish to add my voice to the national outpouring of shock, sadness, following the untimely passing of a 9-year-old child due to complications associated with the COVID-19 virus. As usual, the purveyors of mischief and misinformation got it wrong in terms of the handling of this particular case by medical personnel. Dr. Clyde Cave is in attendance and will go into further detail on that particular matter immediately after my opening remarks. Suffice it to say that this matter was very traumatic for all medical and other personnel involved, and we continue to hold the family, friends, and school fraternity of this child in our prayers. The QEH fought hard to save this precious Barbadian child, but she passed from this life on Valentine's Day. The little girl, to whom I will refer as Child A, is the first child to die in Barbados from a new, uncommon, but serious medical condition, now known globally as multi-symptom inflammatory syndrome in children, or MIS-C. This condition is brought on by COVID-19. Every day, scientists are gaining new knowledge about COVID-19 and its sequelae. The MIS-C syndrome has been described in literature published by the Mayo Clinic as an excessive immune response related to COVID-19 and is seen in children who had COVID but who have recovered from it. Given Child A's symptoms and the management of her case, medical personnel wanted to review all their findings before full confirmation of her cause of death could be shared with the public. Today's notification is therefore consistent with the Ministry's practice of counting and publishing every COVID-related death in Barbados. It is also my very sad duty to inform you that 3 of our senior citizens, 2 Barbadian ladies, one 88 years old and the other 74, and a gentleman 73 years old, died from COVID-19 yesterday. We extend sincere condolences to their grieving relatives and friends. May they rest in peace. Having shared these painful facts, it is therefore important to update you on the situation with COVID-19 in Barbados. On February 14th, some 534 tests were performed yielding 63 positive cases. The reagent from Guyana, on which the Best Dos Santos laboratory was waiting to expedite the processing of swabs, finally arrived. By Monday the 15th, the lab was able to process and give results from 1,251 tests. Of the tests done, 89 positive results were obtained from swabs taken between February 4th and 14th, and 37 positives from February 15th, making for a total of 126 positive tests, 68 men and 58 women. The Best Dos Santos lab has now conducted a total of 115,813 tests. Barbados has had 2,457 total cases of COVID-19, comprising 1,367 men and 1,090 women. Some 28 people have died. There have been 1,698 recoveries, while 731 active cases remain. You will recall that when Barbados met the international criteria for being described as having community spread, the ministry cautioned that transmission of the viral illness within homes and families was a very real risk. This became increasingly evident in the spate of recent cases and deaths involving seniors who were not active socially. It stresses the need for a sense of personal responsibility, maintenance of safety protocols even among members of the same household, and for people to remain indoors. The ministry also warned that people of all age groups can become infected with COVID-19. Indeed, the recent deaths of middle-aged persons and now this child would be testimony of the threat the viral illness poses to younger people. You may wish to be aware that as of yesterday, there were 14 minors in the isolation facilities in Barbados, 17 females and 23 males. So the young people who feel they should not stay home or wear masks and that they can keep socializing are playing Russian roulette with their lives and with ours. So what are our next steps? Bringing lab results up to date so that the Ministry of Health can get an accurate assessment of positivity rates and the pervasiveness of the disease in Barbados. That is important. These assessments will guide any further advice the ministry gives to the Prime Minister, the Cabinet, and to the country. And I must say at this stage that I'm happy to report that the Best Dos Santos laboratory is back to normal in terms of cases. The backlog is being cleared. The last set of tests are being run, and the backlog will be cleared today so that we will get back to currency. Ensuring enforcement during lockdown to restrict movement, as we know that this will help to curtail further spread. The monitoring unit has caught many people breaching the curfew, and several of these will be prosecuted today, I believe, and in the coming days. And on this matter of restricting movement, I'm not satisfied with the still relatively high volume of traffic on our roads. Many persons in this country still appear to be leaving home for the sake of leaving home. This is a major part of our problem. I have therefore made a recommendation to the Honorable Prime Minister, and with the support of the Emergency Operations Center, that we need to do a little more to significantly reduce the number of persons on the roads of Barbados this coming weekend in particular. Accordingly, the Honorable Attorney General will very shortly be issuing a new directive in which we shall impose a weekend curfew, whereby effective Friday 7 p.m. to Monday 6 a.m., it shall be unlawful for persons not in possession of the appropriate pass or not involved in the vaccination exercise either as a service provider or recipient of the vaccine, to leave the confines of their homes. Simply put, if you are not an essential worker, going to work or coming from work, if you do not have a government authorized pass, or if you are not directly involved in Operation Seek and Save or the national vaccination exercise, and if you are not heading to or coming from a medical facility on legitimate business, then you shall have absolutely no permission to be on the roads of Barbados from Friday 7 p.m. to Monday 6 a.m. This ban shall also apply to beaches and public parks. I repeat, it applies also to beaches and public parks. This is a stay-at-home weekend when the Royal Barbados Police Force shall be instructed to apprehend and prosecute all persons violating this order. Ensuring the effectiveness of Operation Seek and Save as a tool for getting sick persons out of households and communities and into places where they can be cared for and the risk to others reduced. I can only continue to plead with all of you that if you or a member of your household is feeling sick, go for medical help right away. Being aggressive and thorough in our contact tracing, we are asking the public to help each other and us by telling us the truth. Your business remains confidential and your business. The Ministry of Health and Wellness is only interested in public health interventions, not telling people how to live. Reinforcing that the first line of defense for every individual is the wearing of masks, the washing of hands, and keeping physical distance. Pursuing a national vaccination program to prioritize and protect our frontline workers, persons with NCDs, and seniors. And I'm pleased to report that having started to test our systems last Wednesday with the vaccination of 30 people and increasing our numbers daily, as at yesterday evening, February 16th, Barbados had vaccinated 6,665 persons. That is nearly 1,000 people a day. Yesterday's daily dashboard showed the vaccination numbers for the first time and will hereafter reflect the daily vaccination numbers. And I want to say a word to those persons who are going to polyclinics and testing centers for vaccines. I've instructed the polyclinics and the testing centers that immediately the only persons who should be coming to those installations for vaccines are persons who are 70 and over, persons who are below 70 and who have and over 16 and who have chronic NCDs, and those persons will receive a telephone call after registering from the Ministry of Health and Wellness and the Vaccine Committee, and those persons will be told exactly where and when to go to receive their vaccines. I also would like to make a special plea to all families in Barbados. We said before that we were beginning to see the impact on families, and we are seeing this impact. So that if a person is at home awaiting a test result, we are asking persons in the same household to remain at home until those results have been returned. We are going to be stepping up what we are doing, and we've had to constantly be adjusting to the prevailing circumstances. And one of the things that we've determined that we have to do is to first of all stem the flow of the virus in the country. So whereas we have a backlog of cases, and I say a backlog because the cases keep increasing, and therefore those on the front line, on the ground, who are doing the contact tracing, they do have a significant challenge, and we will continue to work from the back and coming forward. But we've decided that we are going to make a special effort to deal with the current cases, and once the lab is able to keep current, that this is the way that we are going to stem the tide by dealing with the cases that are most infectious, those that we would have had within recent days, focusing on those and the contact tracing to stem the tide, while at the same time still continuing to work from the beginning and coming forward with all of the contact tracing. I want to say finally that I am really grateful to all those Barbadians who have been volunteering their services, whether it is to the Ministry of Health and Wellness, through the vaccine program, through the contact tracing program, to those who are dealing with the care packages. We thank you sincerely for all of your assistance. I thank also Barbadians who have been praying for us, praying for the entire team daily. We also appreciate that. And to those members of the press, and there are quite a few of you, who have been calling to inquire when things are appearing on social media, whether or not there's any truth in those things, I really applaud you for that. I applaud you for your professionalism. And sometimes when I may not be able to get back to you immediately, it's because I'm heavily involved in trying to manage the situation that is before us. But I commend you for doing what you're doing. Thank you very much.
Thank you very much, Minister. We appreciate your efforts and those of the members of the Ministry of Health and Wellness, who I know are engaged day and night in an effort to protect Barbados. Two of those members of the Ministry of Health and Wellness are here with us. Dr. Clyde Cave, Director of Medical Services of the Queen Elizabeth Hospital, will now speak to the circumstances of Child A. Dr. Cave is himself a pediatric specialist. Dr. Cave.
Thank you, Ambassador. Good morning, all. Before my comments, I would like to make a few generalizations of the multiple roles that I hold so that there will not be continued confusion. I speak as physician-in-chief at the hospital with overall responsibility for all of our patients, which includes the death of children in our intensive care unit. I also am responsible for the staff that provide this service, and as an officer of the Ministry of Health, also responsible in part for the well-being of people of the country. Because we are a small country, it is sometimes difficult to speak in generalities without the armchair detectives who are at home on pause making connections that may not be so. I'm going to speak about a new disease in children, which the details of which are not necessarily applicable to this case. For reasons of confidentiality and good medical ethics, I will not speak about the individual case, other than to say we extend sympathy to her family, her friends, her school colleagues, and everyone who has been saddened by the news of this death. The death of a child is always sad, and especially at this time, on a Valentine weekend when people celebrate other things, and from a disease that has heightened all of our anxieties, it is especially troubling. The disease that I will talk to you about is a relatively new discovery. Less than a year ago, the first cases were reported. It's called multi-system inflammatory syndrome in children, MISC or MSC, or originally PIMS, Pediatric Multi-Symptom Disorder in children. It's all the same thing. The terms we use are COVID-related because at the moment, that is what we think it is. It is not the same as the COVID infections that adults die from. You are all aware that children react a bit differently. Older people get severely ill from the original infection. The deaths of the other 3 persons most recently identified would be because they acquired the virus, and during that first infection, it spread throughout their body. They were unable to deal with it, and therefore they passed away. Children are different. Children can acquire the COVID infection. They deal with it really well, sometimes so well we are not aware that they even are infected. We do know, however, that during that time, they may be able to pass it on. What we are also discovering that in a very select number of children, a few children, they can develop a consequence or a sequelae of that initial infection. Who these children are, it's hard to tell, but we do have some clues from international experience. The first cases in Britain identified Afro-Caribbean children as being at higher risk, and also children who were overweight as carrying an additional risk. How this ties into other conditions that they may already have that may become manifest later in life, like lupus or other autoimmune disorders, which we know are higher in our population. These are all unanswered questions. What we do know is that sometime, usually weeks after an infection, the child may become ill. And becoming ill with inflammation in multiple systems means that the symptoms vary. Usually there's a high fever. If the bowel is involved, there will be vomiting and diarrhea. If the nervous system involved, headaches, possibly seizures or tremors or confusion. If the skin is involved, there are rashes, or the eyes or the linings of the mouth can become very pink and cracked. Any system may become involved. For those of you who are hearing similarities in what I described to other diseases, acute diseases like dengue, which we are currently experiencing in the country, other diseases like Kawasaki's disease or juvenile rheumatoid arthritis or any of the other autoimmune diseases, yes, there are similarities, but with extensive testing, we are able to sort them out. Many of these children with the appropriate therapy can get better, or at least as far as we know, we can control it for the time being. As I said, this is a 1-year-old disease, and we can't tell you what happens 5 years later. But we do know that one of the most important systems that can become involved is the heart. When the heart becomes involved and the heart fails in a young child, especially if the rhythm is affected and you have multiple rhythm disorders, those can be very difficult to treat. And if it's not possible to get that under control, then we have the loss of a child. So these are the many manifestations of this disorder. It is still very rare, but the message to us all is we know that COVID is in our community. We may never know which children are affected, but should there be a change in the well-being of a child, especially with high fever, and especially if it's more than a fever, there's associated vomiting or behavioral changes or rashes or fainting. These are the cases that we could possibly identify as being attributable to this multi-system disorder of children which occurs after COVID. The call to the country is to be vigilant, to look out for it, not really to expect a lot, but as this is a sequelae, not a manifestation of the acute infection, even after we get the numbers under control, we still have to watch out for these cases because they always follow acute infections. Thank you, Ambassador.
Thank you so much, Dr. Cave. Indeed, we understood the breadth of your own qualifications and experience as a pediatric specialist in Barbados who has taught, who has researched, who has worked with many children over the years, and in fact has significant responsibility for the quality of pediatric intensive care unit that Barbados has. I believe that we have a world-class facility here, and I know that you were very much involved in its establishment and development over the years. In your role, therefore, as Director of Medical Services and your vast experience in pediatrics, you were very clear in detailing these very unfortunate sequelae of COVID-19 as they impact young children. Also with us is Dr. Anton Best, but I'm going to open the floor to the press who are with us today. We seem to have a full house. Ladies and gentlemen of the media, would you identify yourselves as you are about to speak, please? Will support or to field any questions from the media, but he is not himself going to make a statement today.
Yes, good morning.
The Nation.
Yes, Paul Monty from Nation News. I think we speak for the entire media fraternity in expressing condolences to the family of that young child and also those who have passed. Just a quick question. In terms of the number of minors, you mentioned 40 minors. This is a question for Minister Bostic. You mentioned 40 minors and a significant number of cases that are heading within the isolation facility. What's the capacity of the facility at this stage? How close are we to that point when that primary isolation facility would be well?
Right, thank you for the question. Between primary and secondary isolation, there are currently 45 persons there, and you would recall that we have a capacity of 78 beds. But what I want to stress to you is that we have been expanding our isolation capacity, and of course the critical care beds are always the ones that we have to be very careful with. And by expanding the capacity, there are a lot of things that have been going on. For example, we'll be making some transfers from Harrison Point to some of the other facilities and trying to focus at Harrison Point with those persons who we are deemed to be ill or very ill, with obviously symptomatic. We are always keeping an eye on the ICU bed capacity, and we believe at this point that we are still in a good place, but if we reach the point where we think that we could become compromised or overwhelmed, then we will have to take some other decisions. But at this time, we are okay, and we are okay in terms of isolation capacity generally. And we can expand as required.
Hi, good morning. Thank you for Minister Bostic, Randy Bennett from Barbados today here. I know you would have said earlier in your remarks that the ministry would have investigated the situation before speaking to members, to the Barbadian public. But Barbadians are a bit concerned that there were reports out of Trinidad and Jamaica highlighting the death of the child before we actually knew what was going on. So I would like a comment in terms of how those media outlets would have been able to report that death before we would have had any information.
Thank you. Let me say it up front that the Ministry of Health and Wellness in these matters, that we are guided, and as Minister, I am guided by our medical officials. And the medical officials had reported up to the day before that there were still some tests being run and that they were not in a position to make any confirmations, and therefore the ministry could not do anything else. Because if there's one thing that I try to assure you each time I meet the press, is that I personally do not like to speak unless I am absolutely sure, unless I have the facts, so that I bring truth to any situation that I'm dealing with the Barbadian public. And up to that time, we had not received any confirmation, certainly from the Queen Elizabeth Hospital team, and so we were not in a position to do anything. It was just as surprised as you are to have seen those things in the press, but I don't know if there's anything that Dr. Cave may be able to add here.
Yes, certainly. Thank you for that question, because this has been obviously a topic of discussion among the Barbadian public. I don't think it is an indictment for people who are thorough that they are not necessarily the first to run with preliminary news. As I understand it, the announcement from Trinidad was not from an official source. It came through the medical community. And what you will appreciate is, in Barbados, we are very proud of our pediatric intensive care unit. It's 4 to 6 beds, which is a small unit, served by one pediatric intensivist, backed up by the entire pediatric department, including a pediatric cardiologist. Whenever in the region we have new, perhaps exciting, but different cases, these experts here share with their colleagues who have experience, and the closest pediatric intensive care unit would be in Trinidad. So there's always discussion. There are times when we share medication, when we are called upon to share stuff that we have with them, and vice versa. And that case discussion did occur. There was never any expectation for that professional discussion to make its way into any public announcements outside of the country. As the physician responsible for overall care, I can tell you that I have reviewed the cases in all of our cases, especially recent cases, and I'm not only confident but pleased that the highest level of care that could be delivered anywhere was delivered from our ICU. It's also important, I think, for the public to recognize that even when there is a sad outcome like a death, this does not mean that everything that could be done was not already done. Thank you.
Good morning. Good morning.
Bostic, Wendy Burke from Starcom Network News. We would have had a list circulating, an Excel spreadsheet to be precise. I've received confirmation that some of those names are not fictitious. So I would like to know what the origin of it was, what the department can do about it, and also what can be done to avoid things like this happening in the thereafter, because it caused great consternation to many who would have seen themselves on that list.
Thank you for your question. When it was drawn to my attention, it also did to me, but I can say to you that there are so many things that appear in social media that I cannot tell you where they come from. I cannot tell you what the intention is of those who produce them. But I can give you 2 examples of information that was shared with me this morning. I am told that there's one person on that list who lives in Bermuda and who has not visited this country since 2019. There's a mother who's very angry at what occurred because her 5-month-old daughter, I think it is, appears on the list. I don't know where the list originated. I can say to you that we try our best to maintain confidentiality to the extent that even when we are pressured by the press to give locations of positive cases and so on, we don't even do that. So you know the extent to where we go in order to try to protect the confidentiality of people's information and documents. So at this point in time, I cannot say anything on that matter because the veracity of it is unknown, and like a lot of the other things, including the situation with our esteemed Governor General, I do not know where those type of things come from, so I cannot really comment any further on it.
This question is for Dr. Cave now. We're getting reports that there are between 15 to 20 positive cases of COVID in accident and emergency. Can you tell us if this is indeed factual, if that's the number, or if there are indeed any cases right now of COVID in A&E?
I know that there is a national fascination with numbers. It is not surprising that sick people in the country who have COVID come to the accident and emergency department. So there are always likely to be patients there until we get this situation better under control. Once a patient is identified there, depending on their needs, they can then be transferred to an appropriate isolation facility. So what therefore happens is that we are dealing in a real-time situation with people coming in and going out. So the numbers at any one moment are almost meaningless because they are so fluid. I'm not sure as of this morning. I know that we did have cases there. I know that some of them will be going to Harrison Point. Some of them who are not very ill will be going to other isolation facilities. I'm sorry I can't give you a specific number, but it would be totally meaningless by midday.
Yes, good
Thank
morning. Again, questions for both, this is a dual question, so it's both Minister and Dr. Cave. Based on your explanation of the disease, Dr. Cave, is this a child that would have recovered from COVID that suffered these complications at a later date? And a question for the Minister, in terms of, I'm sorry, I just lost my train of thought. Oh, yes. In terms of schools reopening, possibility of schools reopening, we know that children cannot be vaccinated. I know that this disease is rare, but does this provide any further complications for the possibility of school reopening even when we have herd immunity?
I will speak in generalities, not about this specific case. This syndrome is regarded as a sequelae to the infection. So we know there must have been an infection. The world experiences that infection can be weeks to months prior to the onset of symptoms, usually in the order of weeks. In fact, it can be so long in the past that the PCR test converts from positive to negative. So it would not be surprising in cases of MISC to find that our tests that we use, the PCR, to identify the acute infection has changed and is no longer positive. But if we look for antibodies, we can find evidence of previous infection. And if we look in the child's immediate environment, we can usually identify other family members who have been infected and therefore extrapolate that the child might have been exposed. Now, we think we know that some children are particularly vulnerable. As an example for better understanding, I think many people are aware of rheumatic fever, which is a disease of the past. Rheumatic fever is a sequelae of some people who get a strep throat infection. Most of us have had strep throat infections, and even without treatment with antibiotics, we get over it and we are fine. But there is a subset of people where their body makeup is so similar in some ways to whatever the germ is, that when the immune system fights the germ, it also fights the body. That's the kind of model we think happens in this disease. The immune system, in its whole very complicated way of eliminating the virus, has a hyper response which unfortunately spills over and attacks other parts of the child's body. This is rare. It is not possible at this time to identify which children would be particularly at risk. One way is to prevent it, is to prevent infection in the first place, which always brings us back to prevention being better than the treatment.
To answer the question in relation to the reopening of schools, that has to result from a discussion between the Ministry of Education and Ministry of Health and Wellness, with the Ministry of Health and Wellness providing guidance to the Ministry of Education. And then a recommendation would be made to the Cabinet Subcommittee and ultimately to Cabinet, which is chaired by the Prime Minister. But what I can say to you, beyond any degree of doubt, is that the Ministry of Health and Wellness would not support anything if it is going to be in an environment that we consider to be unsafe as a result of COVID-19. But those discussions have not been held because we are still in the middle of a battle. Thank you.
Just a quick follow-up. I know that others want to just chime in, but just a quick follow-up. But what I'm trying to ascertain, is this a game changer in your view, in terms of your recommendations for return to school? As I said, especially even after we have achieved maybe herd immunity in the adult population, given the fact that children cannot be vaccinated?
I consider it to be a game changer, and I know that you would appreciate that with a medical condition that is uncommon, that certainly that is beyond this current Minister of Health and Wellness, and that those kind of situations would be guided by the technical people, the medical personnel, who would then advise the Minister. So I cannot answer your question at this point in time because at this stage no consideration has been given to that, because as I said, we are still managing and in the middle of a battle, and a battle that we have to win first before we can consider anything else.
Minister Bostic, I crave your indulgence on this one. My phone is being bombarded. I now have 3 nurses who are on that list and received a call there after seeing the list that they are indeed COVID-19 positive. Is it fictitious?
The question? The last part.
I'm asking you if you can say beyond a shadow of a doubt that the list is fictitious, given that these individuals messaged me to say they saw themselves on the list and then they received news of being positive.
Right. I repeat, I cannot say that it is fictitious. Let me put it that way. But I am saying to you that the document does not bear any official thing from the Ministry of Health and Wellness. I do not know the origin of the document. And that document, like several others, and there have been other documents circulating on social media, that we were able to say yes or no, but in this case, we have not yet been able to make those determinations. The matter was raised yesterday evening, but I, as Minister of Health and Wellness, I was chairing some very, very important meetings dealing with the management of COVID, and I'm not in position at this stage to be able to make any comments in reference to the document which appeared on social media.
Before you go, can you give me an update on the nursing home that is now the isolation facility? And can you tell me whether or not these last 2 recent senior deaths are indeed from that facility?
The 2 seniors, the females, are from that facility. I would have indicated earlier this week that the facility is now being managed by the Queen Elizabeth Hospital as an isolation facility. We are still in the process of doing some work at the facility. We have some nurses who are on board. The executive chair of the QEH should be meeting with the management of the facility, the owner of the facility, this morning to iron out a few things, and we are going to take it over, and we've started the process of doing so, to make it an isolation facility, meaning that the resources for the facility in terms of PPE, equipment, feeding, nursing, doctors, and so forth will be provided by the Queen Elizabeth Hospital, and in some cases with some support from the Ministry of Health and Wellness. And we are also providing a public health doctor a medical officer of health, to help guide the process from a public health perspective.
I thank you. And I guess once they're recovered, they will be on the list as well for the vaccine, given the rampant spread of it at the facility.
In due course, yes.
Minister, for Dr. Bess, have we in our testing, have we encountered persons that were reinfected, that were positive before, and again tested positive again at a subsequent date? Additionally, in terms of vaccinations, I'm aware that you're not supposed to test persons that are COVID positive. Are we doing any antigen tests at the sites to ensure that persons that are going forward for the vaccine are not indeed COVID positive?
Thank you for the question. With regards to the reinfection of persons, so persons who've had COVID in the past and then have it again, we do have anecdotal reports across the globe that this is a possibility and that this has happened. And even though there has been some question about has it happened in Barbados, we don't have any evidence to say definitively that it has happened. We have had situations where persons were tested abroad, had a positive test, were discharged from isolation, but they came to Barbados and they were tested again, and the test was positive. So the immediate assumption is this is possibly a reinfection. But what you have to appreciate is that there's something called virus shedding, which occurs for a very long time in some cases. The test cannot discern if the virus is viable. Okay, so it's going to detect the virus once we do the swab, but we cannot say if the virus is dead or alive. So right now, we do not have any clear-cut, hard evidence that we have had cases of reinfection in Barbados. Regarding the question about doing the COVID test for persons who come for a vaccine, that is nothing that we do or nothing that is stipulated in our protocols. Certainly, if you come for a vaccine and we ask you how you're feeling, have you had any fever, have you had any symptoms in keeping with COVID, that in itself is a contraindication for taking the vaccine. We're not thinking that you may necessarily have COVID, but if you have any viral infection, including, of course, COVID, your immune system is activated, and it is not the ideal time to take a vaccine. And this is across the board for any vaccines. Vaccines need a healthy immune system in order to work. So if anything, any signs or symptoms are indicating that your immune system is currently being activated, we will not give you the vaccine at that point in time. There's no indication, there's no need to do a test, an antigen test, ahead for COVID, ahead of receiving the COVID vaccine.
Follow up, Dr. Bess, not specifically with reference to testing for the COVID, but has the ministry as yet been doing any plasma testing to determine whether or not a person may have the necessary antibodies necessary to fight off the virus and therefore may not necessarily be at the high end of necessarily needing to take the vaccine?
Sorry, I missed part of your question, but I'm assuming you asked about antibody testing to see if a person was previously exposed?
Yes.
No, so once again, that's not...
Plasma for antibodies to help them make a determination about actually taking the vaccine to see antibodies your body produces.
So to the best of our knowledge, there's no need to do that. So even persons who've had COVID vaccine, who have had COVID, the disease in the past, there is a protocol which states that they can receive the vaccine about 1 month after they've had the infection. So there's no need to do any testing to see if you have antibodies to indicate whether you have current infection or whether you've had past infection.
Asha Kamabach from Loop News Barbados. My question is for Minister Bostic. Previously, we would have been getting daily notifications as to deaths, even though the dashboard would reflect to the day before. However, for the last 4 deaths, we haven't been getting those updates. Is there any reason behind that?
The answer is no. No reason behind behind that at all. What happens is that we get the information relating to deaths from the isolation facility or from the QEH if it happens an accident and emergency, but as long as it is a COVID death or COVID-related death, we get the information from the isolation facilities specialist, Dr. Corey Ford. And once that information is produced, it is then passed to the communications team, and the communications team will deal with that. Sometimes we get the information at night, and you would recall that on some occasions a press release or press statement would have been issued, but there's absolutely no reason why you may not be able to get it on a daily basis, as you are saying. It is not a deliberate act of any kind.
Sharika Griffith from CBC. My question is for Minister Bostic. Prime Minister Motley would have indicated on Monday that they were chasing at least 4 leads as it relates to vaccines. I'm just wondering if you've made any progress in any of those efforts to say that we may be receiving some more vaccines soon.
Right. That is one that I know that the Prime Minister is still dealing with. I do not have any additional information at this stage. I can report that we have been in contact with CARICOM, the CARICOM Secretariat, the Assistant Secretary General, who is responsible for public health and who is coordinating on behalf of CARICOM the vaccines from the Gavi or COVAX facility. We are trying to get a few more vaccines because there's 1 or 2 member countries that have not taken up their quotas, but they're still arranging the delivery dates and so on with the facility, and so we don't really have any additional information in that regard. And the Prime Minister is still continuing with her efforts to deal with other entities, but I do not know where we are with those deliberations at this time.
And with the national rollout of the COVID-19 vaccine, have some of the regular vaccination programs been sidelined? I'm asking specifically because I would have heard of several mothers at the Glee Polyclinic on Monday who, after waiting for several hours to get their little ones vaccinated, were told that it wouldn't be happening today.
Well, not sidelined. What I can tell you is that, you see, the Ministry of Health and Wellness, you have so many qualified and certified persons, public health officials. We've been trying to get, and we have received some assistance from the BAM, BNA and so on, but we have had to curtail some activities, some as a result of COVID, but also in terms of this vaccination rollout, which we are trying to complete in as short a period of time as possible, because this is considered also to be very, very critical to our fight against COVID and to save lives. But we will get back to our schedule within days, because it is important that we do so when it comes to certain activities. And also we are also trying to roll out the program in some of the testing sites across the country that are not Ministry of Health facilities. So this is where we are with, in terms of that. But recognize that we're doing contact tracing. We're still continuing with swabbing and testing of persons for COVID-19, and we are doing the vaccination exercise all at the same time. So there have to be some give and take as we go along. But we are hoping to be able to manage everyone over a period of time.
Minister Bostic, can you give me an update?
We spoke about, we're having some reports that there are some lost samples at the lab. I know that there were some issues with the lab as it related to the reagents and stuff. Could you give me an update in terms of any samples being lost and if it's being done to correct that issue?
I've heard this conversation about lost samples at the lab. I can tell you that once samples arrive at the lab, that those samples are processed and they are not lost. I can say to you that there have been delays, obviously, in the delivery of tests. And we would have gone through all of that over the last several weeks. And we would have indicated also that in some cases, the information that is required to accompany some of the samples, all of the information was not there. In some cases, we didn't have information, and a lot of work had to be done in order to try to find out exactly who the samples belong to. And we've been able to do that for the most part. In one or two instances where there was still difficulty in making the link, even though the samples were available in the lab, we reswabbed the persons so that we retested, reswabbed those persons. But the lab is not losing samples, and as I said earlier, the lab today is going to be current, so that going forward, we should be in a better position. But a lot of it had to do with the accompanying information with the samples that sometimes really made it difficult to determine who the samples belong to.
Mr. Bostic, can you tell me two questions I have for you? I'm hearing a family is here messaging me saying that they all tested positive and there was a lag time of 3 days before they were taken to any isolation facility. Can you tell me how this would have happened and what kind of time parameters you're working within to ensure that those persons aren't getting back out into the community to infect anyone else? That's the first one. And the second one is there a bubble at the Coast Guard base of the Barbados Defense Force to contain spread of the virus there? Those are my two questions, Chief.
Thank you, and let me start with the second question, because I will say to you that I am not aware of a bubble at the Coast Guard base, and the Coast Guard base comes under the command of the Chief of Staff of the Barbados Defense Force, and I cannot speak to that. The first question you raised is a good one, and I will admit that there are times where people have been waiting maybe 2-3 days, as you have indicated. And I will explain why. And it is not an unusual occurrence. And I start by saying to you that there are countries across the globe, and including our region, where people, positive cases, especially asymptomatic cases, isolate at home. They are allowed to isolate at home. It depends on capacity. So whereas we have the capacity to isolate persons in facilities, and that is our way of doing it at this point in time. If you have a large number of positive cases, if you have 200, if you have 150, there's some work that has to go into play in order to be able to deal with that. I spoke earlier about the fact that we've been transferring people from one isolation facility to another. Cases also, as you're aware, are assessed. So what we're trying to do, because not everyone is involved in the collection of those persons, and so we have to determine those cases that may be more critical in terms of the infectious rate and so on, to make sure we get those first, and then we get to the others. But there's a process at work, and we are aware in some cases that there are people that might still be at home, and we depend on every Barbadian, the same way we depend on people to remain at home even though they don't have COVID, to remain in quarantine if they're at home or wherever. We do the same in this regard. That's why it's an all-society approach. That is why at the end of the day, it depends on each and every one of us to play our part, because there are some times when we will not have the capacity to move all persons within a 24-hour period, and I can tell you that the teams that are trained to do so, and with the transportation that is available, when we do the processing and so on, those teams sometimes work through 3 and 4 o'clock in the morning to moving people. So yes, I will say to you that this has happened, and it will continue to happen if we have larger numbers than we can facilitate within a particular period of time. But we are trying our best to have some more resources, more people trained to be able to move and to collect positive cases. And we regret that it happens sometimes, but sometimes it is really out of our control.
Thank you. I would like to ask a question of Dr. Cave now, if possible. Good morning to you. Okay, I'm understanding that there's also something called MISA in adults, which comes after COVID as well. Has that been found in Barbados? And do we have the necessary capacity to detect it early enough to ensure that these individuals don't die?
That's probably an even more controversial kind of discussion than the equivalent syndrome in children. We do know that the symptoms from an acute COVID infection can last in some people for a long time. It now seems to be emergent that some people may not have such a difficult time initially, and this emerges later. But the older we become, the more comorbidities we have, and the more likely could these things to be related to something else we have or an interaction with medication. So that's all being sorted out. I think we're expecting full answers of a disease that has not been here for a very long time. So no one, even though lots of people spend a lot of time and energy guessing, can tell you what happens 5 years after you've had COVID, because nobody, as far as we know, has had COVID for 5 years that we can study. So that is something emerging. I know that there are many suspicions about longer-term complications in people in Barbados, but I'm not aware of anybody actively with that designation.
Thank you kindly. Minister Bostic, I don't want to seem like a harasser this morning, but since you spoke to the list, I have received 2 additional confirmations. One person who's given me her name says she's presently in isolation at Harrison Point, and the list is real. The other person who called said they are 2 brothers and they are both in isolation as well, and their names did appear on the list. So somewhere, somehow, a database got hacked.
But I take your question and I take your point, and I would never consider that you're harassing me. You're doing your professional duty, and I don't have a problem with that. But all I'm saying to you is that at this time, I do not know. The question was asked about the list. I don't know where it originated. I cannot make a confirmation at this time about the list. I would never come here and say that it is not true or it is fake. When it was asked the question, for example, in relation to the village in St. Joseph, because it was thoroughly investigated and I had the time to do so, I could say with certainty that it was fake. On this occasion, I'm not yet in that position to say so, although I can tell you that the matter is being investigated by the Royal Barbados Police Force. But I cannot say anything because I do not know. I cannot confirm something that I do not know at this point in time.
I thank you. Just some questions from our online people on Brass Stats with regard to the vaccine. One, whether you're going to expand how it's being done. 2, if teachers are going to be on the priority list for vaccination. 3, if any consideration was given to using schools as vaccination centers. And 4thly, if private doctors are going to be allowed to do the vaccination of their own patients so that polyclinics can free up and be able to do the general public who do not see private physicians.
Thank you again. I will attempt to answer the questions as best I can, but I need to remind you that there is a coordinating committee that is dealing with vaccinations, although the ministry is still represented and by the CMO. And I say that because the rollout of the vaccination program is more of a logistics exercise, although there's a requirement for the technical advice and so on. And so that you do not be surprised that I'm not responsible for the program, I made a request to the Prime Minister not to be responsible because that is a massive exercise, and I did not think that I could manage, along with the staff, Permanent Secretary and CMO and staff at the ministry, that we could manage what we are facing, this COVID battle, and manage the rollout of a vaccination program. But I can say yes, that there are some schools and other facilities that are on the cards, and the team, the vaccination coordinating team, Major Clark, Dr. Ferdinand, they are in the process and they're doing it on a daily basis of putting things in place so that those facilities can be up and running. I can say yes, we have coordinated, we've asked, we've requested assistance from BAMP, private doctors, from the BNA. We've had some assistance, but we need more. And I would ask those entities to kindly speak to their membership so that we can have more personnel available to open those facilities, to take some of the strain off of the polyclinics. Not all of the polyclinics will be involved in the exercise going forward because we still have to maintain other public health areas. So that is what I can say to you. I cannot answer the question relating to teachers and the categorization and so forth because that is with the Vaccine Implementation Committee.
Thank you kindly. I think I'll leave you alone for now.
Minister Bostic, can you say with arrivals into Barbados, if they are vaccinated overseas, will they still be required to have a negative PCR test on arrival?
The answer is yes. We had a meeting with the virologist from PAHO for the few days that he was here, and that was one of the main things that we discussed, and the advices, and also from our own research, from our technical people, is that there's not enough scientific data available in relation to the vaccines and the question that you're asking to be able to make those determinations. So we are sticking with the protocols at this point in time until we are in a position to do otherwise, and we will continue to seek the advice of PAHO WHO.
Barbados Advocate. The question I want to ask is with regards to the vaccination process. Are there any mechanisms in place to protect the persons who are going to get vaccines? And by that I mean that at present there's a couple of catchments, frontline workers and some elderly persons. However, there have been reports of younger persons walking in and getting in before some of the elderly persons, and there have also been other reports of persons waiting 4 and 5 hours to get a vaccination. Are there any mechanisms in place to discourage this kind of behavior?
Thanks for that. The Prime Minister chaired a meeting yesterday to discuss these same points that you are raising, and some clear direction was given as to what we ought to do in terms of reducing the waiting time of persons, because we've had some complaints, I will confess. And then admittedly some persons walked in and were able to get vaccines. We have confirmed this, but that has been brought to an end, and an instruction was issued that only the persons in the categories that we have indicated will be allowed to get vaccines at the polyclinics or any of the other sites when they're up and ready. And in addition to that, we have advised, and I said that this morning, that persons will be called and will be told where to report for their vaccines according to the categories. Polyclinics have been instructed that they are not to give any vaccines to any persons who are not in those categories and are not on the list.
The other question for me is about the list again that you don't want to talk about. You have said that it is under investigation, but what are the legal ramifications or possible legal ramifications for the persons or person that would be for the person that would have put it out there?
I think the law is very clear on issues like that, and especially where confidentiality and persons posting things on social media. But that is a question that will and can be answered by the legal persons, and I would not want to go into that area because that is not my area at this point in time.
Very much.
Good afternoon, Minister Bostic. I have two questions actually, one for you and then one for Mr. Best. Is any consideration being given to supermarkets having curbside pickup to limit the traffic on the road?
Not at this point in time, and I think the Attorney General would have addressed that, but it is still not being considered.
And Dr. Bess? Is there any on the 2 prisoners who would have been recovering for a couple of weeks now?
Sorry, you're asking for an update on the prisoners who've recovered? I do not have any additional information regarding the outbreak at the prison and the recovery.
Yes, good morning. Again, Carl Vilmans here again. 2 questions for the minister. In terms of the survey that would have been conducted regarding willingness to take the vaccine, we still haven't heard any facts coming to the public in terms of generalizations as to the extent of vaccine hesitancy that exists in Barbados. Also, you gave some figures as to the number of vaccinations that would have taken place so far. 6,065, I think, around that number. Could you give me a breakdown of how many healthcare professionals, the nurses, etc., would have come forward for that vaccine, and what percentage those nurses that have come forward represent representative of the healthcare sector? Sorry.
Once again, I'm sorry to have to sound like a stuck record, but the figures that I gave you were figures that I obtained, and obviously we are seeing the figures now on the database, but I am not that involved in the process to be able to provide the kind of granular information that you are seeking, but I promise that I will speak to those concerned so that the information can be shared with the press.
Minister Bostic, I know I promised, but 2 sets of information for you. One of the persons said they got collected last night, so they're at isolation. However, in terms of that list, I do have a red flag for you. The person is walking about the district, and they unfortunately recently lost their mother to COVID, who was positive. So once this press conference is finished, I shall share that information with you privately. On to another matter with regard to vaccines. Someone wants to find out if their parents have mobility issues, if any consideration has been given to perhaps doing some house visits or having a center where those persons could be taken to in order to get the vaccine. And this is the over 70s.
Yes, I can say yes to that because that has been considered, and I know also that the vaccine committee, the coordinating committee, they have also been looking at having some mobile units to be able to do some of those things. I don't have the in-depth information, but I know for sure that those things have been considered, and the committee will speak to those things as soon as they're ready to deliver. But yes.
Okay.
The information.
This is not going away.
Thanks for sharing.
People are asking about this thing called a CT value, which has shown up on the list. They're saying that it is a highly technical number and it is pertinent to a lab. So I think the laboratory is what is being fingered by this particular STARCOM listener.
Police, please, since the matter is under investigation. I'm not.
Yes, thank you, Ambassador. I'll leave it.
Yes, please, because the minister has indicated that the matter is now under investigation, and I imagine that people will call and give all kinds of information, and social media will get hot again. But let us leave it in the hands of the police and let them do any fingering or cuffing, handcuffing. That may have to take place. If there are no other questions,
I'm just wondering, is the AG joining? Is the AG joining this press conference? Because Minister Bostic spoke about curfew, but
joining, in fact, we're about to end.
Remember, I had indicated that the AG is going to make the amendment to the order, and that will be made public, but the AG is not here.
Appropriate notification will be given.
Yeah, I have one final.
Yes, ma'am, we're hearing you, but we have difficulty receiving you.
Sorry about that. We be curious done. Because I or it will like daily case from the and some way to act again. Actually have a document, a document with the statistics.
I didn't hear the question. I'm sorry, we are not receiving you clearly, and I apologize, because this is perhaps the third question that you've asked that we've not been able to get to. So what I'm going to do, because we have been going for a while, and I think many of the questions and issues have been exhausted, we recognize that the Attorney General or further information will have to be given now to give flesh to the issues to which the Honourable Minister spoke. But as we now approach closing, we are clear that we move from pause this weekend to stop inside, and we will receive the appropriate legal and other directives and information on that. But all Barbadians, unless there are emergency workers or frontline workers related to health, are asked to stay at home this weekend. It will be mandatory, a complete curfew from Friday to Monday, as I understand the Minister of Health, and further information will be given. Thank you also to Drs. Cave and Best for joining us today and for their very clear explanations on a number of issues. We caution, as we do at the end of every press conference, Barbadians, please wear your masks properly, wash your hands frequently, and if you can't, use sanitizer that has at least 70% alcohol content. Stay 6 feet, remain 6 feet away from persons who are strangers within the home and family setting. Exercise caution, particularly to the elderly and those who have chronic non-communicable diseases. What emerged this morning, however, was that all of us, of all ages, over the course of the last few weeks, as we have tried to highlight the vulnerable groups, or the groups that are most vulnerable, people seem to have taken it for granted, or taken the view that that means that younger persons, middle-aged persons, are not vulnerable to this disease, and that it is a disease of the elderly. It is not. Anyone can get COVID-19. Anyone can lose their life as a result of COVID-19. We therefore owe responsibility, as the Minister said, to ourselves and to each other, to follow the rules and exercise the necessary cautions and protocols that will protect this country. We have had this morning to confront not just interesting news details and information for our own protection, but sobering national news about death for seniors and now for a child. Let us cover our departed Barbadian sisters and brothers with the prayers of our church. May they all whom this disease have taken from us, may they all rest in peace. Good afternoon to you.
Hey, boo, I could come with you. We ain't see one another in days. I could really do with a little company.
You for real? Come by who? The country pump-us, and they putting you pump-us too.
But you know me, boo. Come on, man. Was just one time, once you're breaking curfew.
One time is too much time for COVID to get in at me and harm me and my family. This is how I see it. Wear your mask, sanitize, respect the curfew, and keep your distance now, so that we could be together later after we beat this pandemic. So let me do like Uncle Barris and feel love from a distance. Ooh.
Stop the spread. Simple so. A message from the Ministry of Health and the COVID-19 Communications Unit.